I will now recognize myself for 5 minutes. On July 10th, the Trump administration ordered hospitals to change how they reported hospitalization rates, testing numbers, and other data related to the coronavirus. Instead of reporting to the CDC, which hospitals have done for more than a decade, they were instructed to start reporting the data to the Trump administration directly, specifically the Department of Health and Human Services. They were given just 2 days to prepare for this drastic change. Leading health groups warn that the changes in data reporting will, quote, worsen our ability to mitigate, suppress, and recover from our national public health emergency, unquote. Other experts are concerned that this decision may have been made so the Trump administration could control and hide data it finds politically inconvenient. Dr. Redfield, when did you first learn that the administration planned to move the data from CDC to a different portal run by HHS?
Well, Congressman, we weren't directly involved in the final decision, but what I can say is that CDC then and now continues to have access to all data, does all data analytics, so there's no restriction of any of the data, and that data we continue to forward face the American public.
Dr. Redfield, when did you first learn? When were you first told? When were you first notified?
Again, as I mentioned, I wasn't involved in the decision.
So you were never
I don't remember the exact date.
Am I to understand?
I don't remember the exact date.
Am I to understand that you were not told at all?
Well, I was told, actually, once the Secretary's office made the decision, that that was the decision, and we worked together.
So how long was that?
I don't remember, but I can get back to you the exact date. But we did work in cooperation to help make sure that this was done in an effective way.
Reclaiming my time, did you agree with this decision, Dr. Redfield?
Again, I think it was an important decision in light of the...
Did you agree with the decision?
Yes, I said it's an important decision.
Thank you. Did you discuss this change with Vice President Pence or with Secretary Azar?
Not directly.
Indirectly?
I talked directly with the individuals responsible within the Secretary's office.
So did you discuss it with the Vice President Pence?
No.
Did you discuss it with Secretary Azar?
No.
Who told you about the reasons for this change?
Well, I think we collectively understood the reasons, if I can answer, is there were substantial advancements in therapeutics with remdesivir, which made it really important to be able to understand who was newly hospitalized in real time that day, so allocations of remdesivir to get to that hospital.
I thank you very much for that. And so you developed the reasons. No one dictated the reasons or told you the reasons for the change. You came up with the reasons?
Congressman, yes, I think it was important that we were able to, in real time, be able to know where remdesivir needed to go. And the system that we had developed, the National Healthcare Safety Network that we do for...
So were you told about the changes, why they were being done, or did you and others develop the changes? Who told you?
We work together cooperatively. We work cooperatively together, members of the HHS and CDC, in recognizing the importance of these changes. Okay, I only have so much time. The Trump administration has threatened to cut off the supplies of remdesivir to hospitals that do not follow the new reporting mandates. Dr. Redfield, this is the only drug known to successfully treat the coronavirus. Should a patient be denied access to a potentially life-saving drug like remdesivir because a hospital was unable to comply with a sudden change in HHS reporting requirements? My understanding is we continue to do everything to make sure remdesivir gets to all patients that would potentially benefit from it.
But do you agree that they may not be able to get them to patients because of the way that the information was given and the time frame that it was given in?
Congresswoman, I would disagree. I think the reason the changes were made was to assure that individuals could get access to remdesivir in a timely fashion.
Would you agree that we basically, well, this is the only drug known to successfully treat the coronavirus. Should a patient be denied access to a potentially life-saving drug like remdesivir because a hospital was unable to comply with a sudden change in HHS reporting requirements?
And again, I'm trying to say I think the intent and the consequence of what was done was to ensure that patients aren't denied access to remdesivir, to make sure we get timely distribution to the hospitals where these patients are.
Thank you very much. I've exhausted my time.